All right, so let's talk about incisions used for Precision Sculpt liposuction. We're gonna go over all the incisions from neck to ankle. For chin lipo, or chin, neck, and jawline lipo, as we call it, we use 3 incisions. One right underneath the chin, nicely placed in the fold. Another one underneath the ear, near the angle of the mandible. And another one here, so we use 3. 1, 2, 3. For the buffalo hump, also known as the dorsocervical fat pad, we use 1 single incision at the midline, really at 6 o'clock. So if I'm looking at the back and here's your hump, we place an incision right at 6 o'clock and we use a single incision to remove that entire fat. For the arms, we typically use 4 incisions. 2 placed around the elbow, inner and out, and 2 placed within the armpit right at the crease. 1 right at the back portion and 1 at the middle portion. This gives full access to the entire arm, front and back. For the front bra roll, which is this area, we typically use these 2 same incisions and occasionally add one in the midline of the lateral chest at the level of the lower part of the breast. So typically here, it allows me to come up, these allow me to come this way. If it is a smaller area, sometimes we just stick with 2. If it is a larger front bra roll, it is additional incision here. When we're doing the armpit, it's really an extension of this front bra roll, but heading into this whole area and in the upper back zone. And again, 2 incisions here and definitely an incision here. This allows for full access this way. These allow for full access down here so we can crisscross and get rid of all the fat. For a male chest, we use a few different approaches. We place an incision in the anterior part of the axillary fold, hidden right here. We place one right at the edge of the nipple, and we also use the same incision on the side of the chest. So it allows us to come this way, come across, and really work this. If we are doing liposuction of the breast, which is unusual, but it is possible, we usually add an incision down below at the fold. These are all very small 2 to 3 millimeter incisions. For the abdomen, we use a few incisions, and so they start with 1 at the belly button. It's right under the lip of the top here, very well hidden. We place 2 incisions close to the groin here. Sometimes I would place them towards the center, sometimes they're a little bit further out, depending on the anatomy. And a lot of times I place another one right above the pubic bone here. So 1, 2, 3, 4 for this area. These and this one can be used as well for the flanks and the waist. And when we're doing the 360, we add one just below the love handle. And we use one in the lateral chest. And then we place one in the fold between the buttocks at the buttock crease and very well hidden there, okay? So we use 1, 2, 3, 4, 5, 6, 7, 8, and 9. That's for the 360. So if we're just doing the back bra roll, then we'll make an incision right in the armpit crease. We'll make another one right at the lateral border of the breast in the midline here. Sometimes we'll come down and make it in the hip, and sometimes we'll also add it into the lower back right at the buttock crease, depending on the extent of the bra roll. Incisions for the BBR, that is the Brazilian butt reduction. So if this is your butt, right, we're looking at the back. Place one right in the center, that's right in the middle of the crease between the buttock creases. I place one on each side below the butt here. They're well hidden in the crease. And then typically to get around the sides where the hips are too wide and full, we're making at least 1, sometimes 2 incisions out there to get great access. So for the thighs, anterior and inner thighs, incisions are placed in the groin, right near the crease. We also place one right roughly about here, and one back here in the crease in the inner part of the buttocks, okay? So typically 3 incisions to come at it from all different approaches. Outer thigh lipo, like the saddlebags, is on the outside here. So usually there's too much fullness. So typically I'm placing 1, 2, and 3 incisions. This one is in the crease. These 2 are exposed, but they're very tiny. And again, it allows me to come at it and crisscross to help keep things smooth. As we carry on down to the knee, I I usually use one incision for the knee. And so that is placed roughly right here. It's on the inner part of the knee, and we work really just on the inner part of the knee. The calves and ankles, the calves can be approached through the inner knee incision that we talked about earlier, and through incisions around the ankles. And that is essentially in the front here, down low, allows me to work up on the front part, getting the ankles or cankles, and underneath, so by the Achilles tendon here on each side, so that way you can work all the way up. So we have long, thin cannulas to reach all the way up into the calves.